Metabolic syndrome is a cluster of conditions that dramatically raises risk for heart disease, stroke, and type 2 diabetes, and an estimated 1 in 3 adults may meet criteria today, often without obvious symptoms. What it is, why it happens, how to recognize it, and proven steps to reverse risk, including lifestyle, medications, and tracking tools, plus a hopeful closing for patients and families. What is metabolic syndrome? Metabolic syndrome is diagnosed when at least 3 of 5 are present: elevated waist circumference, high blood pressure, high triglycerides, low HDL, good cholesterol, and high fasting glucose or insulin resistance. Each factor is risky alone, but together they multiply risk for atherosclerosis, heart attack, stroke, and type 2 diabetes, making early detection and action essential. Why it matters? People with metabolic syndrome have roughly double the risk of cardiovascular disease and about 5 times the risk of developing type 2 diabetes compared to the general population. It also links to non-alcoholic fatty liver disease, chronic kidney disease, and other complications that can be prevented or slowed with targeted care. How common is it? Estimates suggest about 1/3 of adults in many countries have metabolic syndrome, reflecting modern nutrition and activity patterns and increasing age. Prevalence is rising globally, including in India and other rapidly urbanizing regions, driven by visceral adiposity and sedentary lifestyles. The core biology. The engine of metabolic syndrome is often insulin resistance. Muscles, fat, and liver respond poorly to insulin. Glucose stays high and the pancreas overproduces insulin, hyperinsulinemia. Visceral fat releases free fatty acids and inflammatory cytokines, worsening insulin resistance, raising blood pressure, disturbing lipids, and promoting a prothrombotic, inflamed state. The 5 criteria explained. Abdominal obesity. Large waist or apple-shaped body signals visceral fat. Typical cut points used in diagnostic criteria around greater than 102 centimeters, 40 in men, and greater than 88 centimeters, 35 in women, with some ethnicity-specific thresholds used in practice. Triglycerides. Fasting triglycerides, 150 milligrams DL or on treatment for high triglycerides, indicates atherogenic dyslipidemia common in insulin resistance. HDL cholesterol. Low HDL, less than 40 milligrams DL in men, 50 milligrams DL in women, reduces vascular protection and co-travels with high TG in metabolic syndrome. Blood pressure. Systolic is greater than or equal to 130 or diastolic 85 millimeters Hg, or on treatment reflects vascular stiffness and sympathetic activation seen with visceral adiposity. Fasting glucose is greater than or equal to 100 milligrams DL. Prediabetes or diabetes diagnosis indicates impaired insulin action and higher cardiometabolic risk. Symptoms and silent risk. Most components are silent. High BP, high TG, and low HDL rarely cause symptoms, so many people don't realize their risk until screening is done. When glucose runs high, classic signs include thirst, frequent urination, fatigue, and blurred vision signals to get tested promptly. Who's at higher risk? Risks rise with age, sedentary lifestyle, high-calorie, ultra-processed diets, family history of diabetes, and conditions like PCOS, sleep apnea, and fatty liver disease. Urban living patterns, stress, and inadequate sleep further worsen insulin resistance and visceral fat accumulation, compounding risk over time. How clinicians diagnose and assess. A typical workup includes waist measurement, blood pressure, fasting lipids, TG, HDL, fasting glucose, HbA1c, and often liver enzymes, and assessment for fatty liver and sleep apnea. The presence of any 3 criteria confirms metabolic syndrome, prompting a comprehensive risk reduction plan and regular monitoring. Health impacts to know. Metabolic syndrome accelerates atherosclerosis, raising risk for heart attack and stroke beyond the sum of its parts due to synergistic vascular injury. It is also linked to NAFLD, NSH, chronic kidney disease, and higher perioperative risks across many surgeries, underscoring the need for pre-op optimization. Lifestyle foundations that work. Nutrition. Emphasize minimally processed foods, high fiber, vegetables, fruits, legumes, whole grains, lean proteins, and unsaturated fats. Reduce refined carbs, added sugars, and trans fats to improve TG, HDL, glucose, and waist. Activity. Aim for at least 150 minutes a week, moderate aerobic activity plus 2 days of muscle strengthening. Movement improves insulin sensitivity, BP, and lipids even before weight changes. Sleep and stress. Prioritize 7 to 9 hours in stress reduction. Practices since poor sleep and chronic stress worsen insulin resistance and BP. Targeted medical therapies. Glucose. Metformin improves insulin sensitivity. GLP-1 receptor agonists and dual incretin agents can reduce weight and improve glycemia, benefiting multiple syndrome components. Lipids. High triglycerides and low HDL respond to weight loss, refined carb reduction, omega-3 intake, and medications were indicated, for example, statins for overall ACVD risk. Blood pressure, dietary sodium reduction, DASH-style diets, activity, and antihypertensives as needed help prevent vascular events while other components are addressed. Tracking progress at home. Track waist circumference at the navel, blood pressure with a validated cuff, morning fasting glucose if advised, and periodic lipid checks with a clinician. Small reductions in waist and improvements in TG, HDL, and BP translate into real reductions in cardiovascular and diabetes risk over time. A practical 6-week starter plan, weeks 1 to 2. Replace sugary drinks with water, unsweetened tea. Add 2 cups of vegetables daily. Walk 20 to 30 minutes most days. Weeks 3 to 4. Add 2 strength sessions week. Swap refined starch at 1 meal for legumes, whole grains. Set a consistent 7 to 8 hour sleep window. Weeks 5 to 6. Introduce interval walking twice weekly. Increase fiber to 30 grams per day with beans, oats, and seeds. Review BP, waist, and fasting labs with a clinician for medication tuning if needed. Encouraging mindset and stigma. Metabolic syndrome is driven by biology and environment. It is not a personal failure, and compassionate, stepwise care yields sustained gains in health and energy. Focus on function, stamina, and numbers that move waist, BP, TG, HDL, fasting glucose because every small win compounds into major long-term protection. Hope message: metabolic syndrome is reversible for many through steady habits. Smart medical tools and supportive care progress compounds and protects for years to come. Small steps, big protection. Every healthy choice rewrites the future. Today's habit becomes tomorrow's health. Stronger each week together. If this helped, like, share, and subscribe. Someone's breakthrough might start with this video.